Good morning. Very good Monday morning. So we were discussing in the earlier video about the implants and ADC questions, and we shall be continuing with that itself. For all those people who have bought my Ultimate ADC Companion book, these questions are from those books, and I'm just giving a little detailed explanations about it. For those people who don't know what this book is about, but at the end of the video, I'll show you the page cover and how to get in touch with me. This book basically has all the ADC recommended textbooks of the dental subjects that of which you are going to give the exam on. SBQs formatted out of those chapters from those textbooks which is recommended by ADC, not your regular textbooks from which you must have graduated. And because you're giving an ADC exam, you have to study from the resources that they are recommending, correct? Which you may or may not have studied. So anyways, let's go to the implant questions and let's continue like a few more of it. Which parameter is most critical to implant stability at placement? Okay. Now I understand even if you are just a basic dental graduate at the moment and you may or may not have seen how implants are done, and definitely you may not have read the book Wiley and Blackwell from Implant, from where these questions are being taken, which is recommended by the ADC. You still can answer these questions. You have to sometimes just use your common sense a bit and some basic knowledge about implants. I'm not saying that you have to be an implantologist to answer these questions, or you have to be a practitioner who has to learn how to do implants to answer these questions. A bit of theory definitely is needed. But even if you have not read much about it, you can still use your common sense and arrive at your answer by eliminating the other options. Okay, so now let's see this question for example. Like I mentioned, which parameter is most critical to implant stability at placement? Now, initially, if you read and you think, oh, how am I going to answer this question? Just see the options first. Crown to root ratio. See, crown to root ratio matters when you're giving a crown, right? An implant, there is no concept of a root and a crown. Implant is an implant and it's going to be osseointegrated in the bone. So a definite length of implant is needed, but there is no crown to root ratio per se kind of thing over there, which is there very much in a natural tooth. So crown to root ratio is not an option. See, because there is no PDL ligament, right? So if there is no PDL ligament, there is no chances of root resorption happening. And there is no concept of implant resorption. It's either osseointegrated or it just completely fails. So crown to root ratio is not the right answer. Primary bone to implant contact. Okay. Soft tissue thickness. Soft tissue thickness is not the most critical factor. I mean, there has to be a bit of soft tissue thickness, but that doesn't matter to my implant that much because it's going in the bone, it's not going in the soft tissue. Implant color. Implant is going to be submerged inside the bone. What are we going to do with the color? So you see, if the rest of the three options are not making much of a sense, then whatever remains is your answer. So you can either arrive at your answer by knowing the answer beforehand, or you can arrive at your answer, the still correct answer, by eliminating the other options. You understand? Which is equally okay. In the world, you will not know everything. So sometimes you just eliminate and reach the right, answer. So that's absolutely okay. Now, what is primary bone to implant contact? It's basically the mechanical engagement of the implant with the bone. It has to be properly screwed inside the bone. The implants have those threads, and when you're going to drill, the threads have to engage the bone. Then only it's going to stay. Correct? Now, what is the primary goal of a surgical guide in implant dentistry? Very good question. Now, I want you to understand something, and that's why I'm going to show you a 1-minute video. The difference between a surgical guide and a surgical stent. Do not confuse. These are two different things. So, let me just, So, let's just see this video. This is a surgical guide and this is a surgical stent. A stent basically is fabricated according to the mold of your jaw, but it does not have an... Okay, let's just play this video, then we'll talk. Yeah. So I want you all to see this is a surgical stent. It gives you an area where the implant has to go, but the angulation of the implant is still dependent on you. You know, it's not like a direct, you can insert something. You still have to manage the angulation because it's a wide area and you can pretty much place implant anywhere. But it does help as a direction, you know. But in a surgical guide like this, yeah, I want you to see this part. Now, in a surgical guide, the implant can go inside the bone only in one direction. So, a surgical guide is like a piece of cake when you're doing an implant because you have fabricated this exactly according to how you want the actual angulation of the implant. Like you just literally drill through the stent and you place an implant. You don't have to bother how deep it's gonna go, you don't have to bother the angulation about it. So, this is a surgical guide, okay? I hope you have understood what a surgical guide and surgical stent is now. So guide is like exactly on the spot, how much ever millimeter you want to go, you have pre-decided. You have just placed the guide, you just drill through 5 minutes, your implant is done. Like it makes life easy for everybody. There is minimum blood loss, there is minimum bone destruction, flaps, etc. Surgical stent, on the other hand, does give you a bit of a guidance, but still the angulation is still in your hand, and how much depth you have to go inside is also in your hand. Okay, so you should spend a lot of money in getting the surgical guide done because then clinically it saves a lot of time. It's easier, it's smoother. You know, it's like a chauffeur-driven car. So yeah, that is what a surgical guide is all about. So now let's get back to the question. Now, what is the primary goal of a surgical guide and implant? Primary goal. See, adjectives, no? Australian dental exams, like adjective dental exam, you know, so many adjectives. Most important, initial step, best answer, like. So, primary goal, you know, what's the primary goal? The primary goal is to prevent bleeding, increase torque, maybe, enhance accuracy of implant placement. Yes, we just learned that. Improves aesthetics. Aesthetics is not a concern at the moment you're placing an implant. Prevents bleeding. It doesn't prevent bleeding, but it does definitely minimize bleeding. Increase torque. Well, yes, it does give you a better what do you say, efficiency in placing the implant. So you do get to place implant with a good torque, but of course you cannot make it too tight. Torquing is basically screwing motion. You cannot be too tight, you cannot be too less, but it does increase your efficiency in screwing the implant properly. But the primary goal is enhance accuracy of implant placement. You saw in the surgical guide, that the video that we just saw, you just have to place it, you know, and it just goes directly in the angulation that you have pre-decided. So there is a lot of pre-planning work that goes on, because at the clinical step, then it becomes very easy. Like it's basically just a half an hour appointment. Then if you have to place one implant, and the surgical guide is so useful when you're placing like 3-4 implants at a stretch. It reduces your clinical fatigue. You know, imagine you have to place all on 4 implants, example, at different angulations and location. Place the surgical guide, drill 1 implant, drill 2 implant, 20-30 minutes, your 4 implants are placed, you are happy, patient is happy. So whenever you try to do an implant, it's okay, increase your lab expense a bit, but you get a lot of mental peace, you know. Now, which of the following patients require additional medical clearance before implant surgery? Additional medical clearance meaning you have to involve a general practitioner or a specialist and take clearance from them, because there is some other medical condition also that the patient is having which you are not fit to give the clearance. ASA1. ASA1 is basically a normal person, like nothing problematic. So that does not require additional clearance. Well-controlled diabetic. If the diabetes is well controlled, you can still manage. You don't need a clearance. On IV bisphosphonates, Bisphosphonates are one of the favorite topics of ADC. Do expect questions. Do expect questions on BRONJ, MRONJ, at least 4 to 5 questions in your exam. Be very thorough with this topic. Learn the medications, learn the brand names, understand the difference between oral bisphosphonates and IV bisphosphonates. IV bisphosphonates, of course, are very intense, and there is a window period where you can work and there is a period where you cannot work. So usually just before the next injection is a good time to work. But again, read from therapeutic guidelines or go through my comprehensive book or watch my other videos on bisphosphonates and you get more idea about it. So a patient who's on IV bisphosphonates, yes, you do need an additional clearance. You need to understand when the next dose is due, and you need to also see if the patient is keeping up and how is the status. So his GP or his specialist has to be contacted and a clearance has to be obtained from them. Takes aspirin daily. Somebody who's having any blood disorders, not disorders as such, like a clotting, there's more chances of clotting, or they have a valve replacement, or any other issues which requires them to take aspirin. Aspirin is a blood thinner. So if you just see the blood report and you find the INR, that's internationalized normal ratio of prothrombin basically, between say 2.5 to 4, you are good to just proceed and you don't need a clearance. Unless the ratio comes more, then you are supposed to refer that patient to the GP or the specialist and then get the clearance. But otherwise, you are good to proceed by yourself. But do not ask them to stop aspirin, of course. You just be prepared with more thrombotic factors with you, like just to assist in clotting of the blood if you think the bleeding is just a little more taking time to clot, like that. So in especially people who take aspirin, the surgical guide is a boon, because you are going to minimize the bleeding, there is less trauma, less headache for you. And the last question for today, implants should be placed at least how far away from the inferior alveolar canal? 2 mm. Now this is something to be remembered. So there must be a book in which you must be writing the notes and important points. Write this point. Now very important. Now these constitute as a basic general knowledge that a general dentist should have. Even if you have just graduated and had zero knowledge of implants, you need to read the basic stuff. I understand it's not possible for you to read the entire textbook at the moment if you're going to appear for your September exam. But if you go through all these questions that I've provided from that book, the basic questions which are the same which are asked in ADC exam, you will feel confident, because when you start reading these questions, you start doing some lateral studies about it and you get more information. Not only exam point of view, but from clinical point of view as well. Tomorrow if you have a patient or you're talking to a colleague, you know what you're talking about. You're not like just blank and behave as if you don't know, because any patient who comes to you would expect you to have some knowledge about the implant. Yeah, it's okay. You can refer to a specialist, but you cannot be just blank and say, what, I don't know about implants. Right? So, and sometimes some patients might just ask you a little more detailed questions about implants, so you should be knowing about it, right? And then that would give the patient confidence. It would make you feel better about yourself. Like, I'm a pediatric dentist, like literally implants and me have nothing to do with each other, because you cannot place implants in children. But yet I did take an interest and studied more on implants, because I'll tell you, there are parents of the patients. Now when you finish your work, and sometimes the parents get comfortable with you and start talking, and sometimes they say, what, doctor, I think I have a gap, and what, I need an implant. So I don't directly just say, okay, what, I'll refer you to a specialist. I'm like, okay, let me just see the area, then I can guide you approximately, what you are going to expect to go through, because some of these patients are blank. They just know the word implant and they ask you, what is it about? Can you just give me some information? So when you check the area and then you tell them, what, I think there is a lot of bone loss that has happened. You might need some bone augmentation with it. You're kind of preparing them for the implanting, and they feel more confident that they are getting some more information which they did not have already. And then they sometimes ask you, doctor, which implant is better. So then you say, okay, there are a couple of good brands like Strawman and they are good, and then you refer them to a good implantologist. And then you also follow up with the case, to maintain a good relationship with the implantologist and the patient also. And you also get to learn. You ask your friend once the implant is done, how was it? Was there any complication? Is there something that you need to do? So then they start discussing, they start showing you the x-rays, you start getting more hang of it. So it's always good to be updated, basically, even if you're not the one who's doing it, correct? So yeah, now coming back to from where I've taken these questions, like I mentioned, from the textbook Wiley and Blackwell. And from which book is this? This is the book Ultimate ADC Written Exam Companion. It has 1,400 such questions from these many topics, like there are 21 of them, and all of them from the ADC recommended resource. It has taken me a mammoth time to go through the books, prepare questions, and give it to you with explanations. And definitely a must-have book according to me. Only if I had this book for my exam, my task would have been so simpler. But anyways, I did understand the difficulties that I went through. So being an academic lover, anyways, it was just a treat for me to read, gain more knowledge, and prepare questions and put it out in front of you. So how to reach me for this book? You can just email me and I will reply back. I will send you a sample copy of 100 questions from this book. You can just go through it and then we'll see it from there, okay? So you can email me on the link, not on the link, on the email address provided in the description of this video. Have a nice day. Bye-bye.